Thank you for allowing me this opportunity to give you a community update on the changes that have taken place around the COVID-19 crisis and the impact that it's having on our university as a whole. Most of you are now aware that Governor DeWine, in coordination with Dr. Amy Acton from the Department of Health, have now issued an executive order across the entire state of Ohio for what is essentially a shelter in place. They're referring to it as a stay-at-home order. These are taking the measures that we had already implemented and simply putting the power of the governor's office behind enforcement, so that now there is a discretionary opportunity for the police force to be able to actually enforce these orders with the full force of the law if they deem that to be appropriate. This is just another sign of the substantial escalation that has taken place regarding COVID-19 and our understanding of the impact that it's having and will have on our community. For those of you who've kept up with the news, you know that New York is in absolute crisis mode. There are over 15,000 cases that were tested positive as of yesterday, and they are expecting that they will run out of many critical medical supplies by the end of this week, and will and have started to exceed their medical capacity to be able to take care of patients who have become ill with this virus. This is a serious time for all of us. The Surgeon General announced today to expect things to escalate to become substantially worse over the course of this week. So we ask you all, please continue to place measures in place that we are asking you to do, that the governor is asking you to do, that the President of the United States is asking us to do, to ensure the health and safety of our communities and our families. I do want to thank our NeoMed community for stepping up to ensure that things are continuing to move forward for the university, that despite the fact that most of us are now operating from at home, we are continuing critical services. We are delivering education to our students. We are continuing to ensure that payroll is fulfilled so that our employees and our student workforce are able to maintain their financial sustainability. We are taking care of mail services, and our police force is here and looking out for the health and safety of this campus. So I want to thank all of them and all of you for what you are doing for us. Many of you saw that I put out additional guidance this weekend. Some of that has changed rather quickly over the course of just a day, where we are now fully enforcing Governor DeWine's orders. While it hasn't changed, we're asking to stay away from the university as far as the campus itself, especially within the buildings of the university. What we are asking you to do now is also to monitor temperatures. So each person is asked daily who is coming on campus within the building complex to report what their temperatures were for that morning. If you are at or greater than 100.4 degrees Fahrenheit, then you are asked not to come to campus and to please follow CDC guidelines for self-quarantine. This is critical for all of us to ensure your health and wellness and that of the rest of our community and our community's family members, friends, and close personal contacts. We are also asking our students not to come to campus unless they have no access to the internet through which to be able to conduct their educational programs, in which case they must enter through the news center, and we ask that they not congregate closely and maintain 6-foot social isolation. This is for your health and safety and that of your classmates. The NeoMed police force has been asked to ensure that this is being enforced. For our faculty and our staff, the majority of you are now working from at home, but we do ask those of you who are in here because you have mission essential requirements that you limit this as much as possible, that you also abide by the temperature rules, and that you also self-quarantine if you have any symptoms of concern, especially new upper respiratory symptoms, or if you are showing any signs of being febrile with a fever at or greater than 100.4. For our faculty, one of the key questions that's come up is research. What qualifies as mission essential or mission critical research? I am not coming in to micromanage at that level. This is something that you, in coordination with the VP of Research, Dr. Steve Schmidt, as well as your chairs, will have to determine. Certainly critical work that will move us forward, such as that being conducted by Dr. Angelo DeLucia here on our faculty, where he's studying the research of viruses that could contribute to better understanding COVID-19 and associated viral syndromes, would be deemed critical. For others, you need to determine whether or not it can wait for a period of time or whether your research is absolutely essential so that you don't lose critical research elements that are already underway. In doing so, please parse down your staffing. We do not want staff members here when the research does not require them to be present. It may be time for some of our researchers to begin actually performing the bench work if you are not already doing so, and relieving some of your local workforce from those duties, especially those who have a requirement to be at home taking care of children with the disbandment of schools, and those who are at high risk or those who have high risk members at home. For our staff, thank you again for all that you're doing to keep us functioning as a university. As I said, payroll is continuing to be met, phone calls are being answered, emails are being responded to, and our faculty, our staff, and our students are being taken care of. Please continue to reach out to your supervisors and keep them abreast of what is taking place on a day-to-day basis. And for those of you who are able, please enroll and participate in the Lean Six Sigma program. The university stood up very rapidly in order to help with professional development during this critical time. We now have 152 members signed up for that course. We've opened it up to our community. About 53% of the enrollees are from Neomed. The rest are mostly from Ohio, although the word has gotten out. We actually have a physician from Alaska who is taking participating in this course. For our students, you continue to make some of the greatest sacrifices, especially as we've had to tailor down your educational experiences, removing third and fourth years from the clinical setting, both by state and national mandate, at least for a period of time. And also for the fact that we've had to take away some of the really important traditions in recognizing the progress that you've made, your achievements here at Neomed in becoming our future workforce in the healthcare arena. We recognize that our third and our fourth years we're delivering care at a substantial level in critical parts of the healthcare team, both in pharmacy and in medicine. And we also recognize that our fourth years will be the very frontline healthcare delivery personnel in just a matter of about 12 weeks. So thank you for bearing with us. We thank you for your sacrifices. We are doing everything we can to try and maintain those traditions in unique and novel ways. I thought that the experience delivered by the College of Medicine for Match Day was absolutely spectacular, and in many ways allowed you the ability to give a more tailored and individualized experience than you would have gotten convening together as a large group of several hundred individuals. I very much enjoyed the opportunity to participate and thank all of our students, our staff, and our faculty who were able to make that happen. Some of the questions we've received out of concern from our fourth year students is, if we are in the clinical setting, we're being put at risk. Should you be doing this? You're currently not asking this of your staff and your faculty here at Rootstown. And that's true. There are several things that we must consider. One, with great caution, ensuring personal safety as greatly as possible. Those of us who signed up to be on the front lines of healthcare need to be able to do so. It is part of our profession. It is part of the oath that you will take, and I have taken with those who are already out there in front of you. And we must do it so in a way that is absolutely going to reduce our risk, to mitigate those risks of us becoming infected. And it is a risk that many of us will be assuming and have assumed. This is a personal decision for many of you. If you are in a high risk category, if you have high risk individuals in your home or that you come into close contact with, you need to decide whether or not you need to be pulled from this clinical setting when the opportunities arise. Two of the questions we came to us this week were from two of our P4 pharmacy students. We truly understand that this is a concern for you. Currently, the national accreditation bodies are not lightening up on the requirement for your clinical experience in the College of Pharmacy. I've spoken to your dean, Dr. Richard Kasmer. He is actively working on this, and the solution may be that if you feel that the concern is too great, the risk is too great for you, please contact the College of Pharmacy. What they will do is work to pull you from those clinical rotations. However, it is very likely it will delay your graduation, but that's okay. It will only be delayed as long as absolutely necessary for these current crisis situation, and then we'll get you back in to be able to finish up your curriculum so that you can get out and you can practice and earn the degree that you were here for. We do not want anybody to feel that they are being forced into this particular scenario. Our current third and fourth year medical students are not in the clinical settings. There may be a push to get them there soon, as we are starting to realize that we're going to run into substantial manpower issues within the clinical setting. We're seeing this take place in New York now. Many of you have heard that this crisis has become so great in Europe that medical students were graduated nearly a semester early in some instances, and they are being put on the front lines well before they normally would have been in a position to do so. This is a time of national crisis when many of us may need to step up early and to do things that we were not yet ready to do. I ask you to please bear with us as we do so in a way to ensure your health and your safety as much as possible. But we do know that our healthcare providers are at increased risk, and there seems to be initial data to show that some healthcare providers are actually at substantially increased risk relative to the normal community. So please let your deans know, please be in contact. If it's a concern for you, we will work with you. It just may mean delayed graduation, but we don't know that for sure. We're working on that with the national bodies so that we can best address your needs and your requirements. We are also limiting your position here on campus for your health and safety. It's been noted that many students are still continuing to come into the news center, and we encourage that for access to the internet if you do not have it at home. What has been a concern is that social isolation has not been followed in some circumstances. It's been noted that some students are congregating in 4s or 5s in small booth areas or tables. We are going to ask you to have one individual per table and maintain at least a 6-foot distance from one another. Remember, the majority of you will either be low symptom providers or you will have no symptoms, and yet you'll shed virus that will put the rest of the community at risk. While I'm on that topic, many have discussed the fact that Neomed has not yet had a confirmed positive case of COVID-19 in our direct community. We've had some who were under investigation and tested negative. To put this in a little bit greater context for our research faculty as they make their decision as to what is mission critical research, many of you may be aware, but I want all of you to be aware that one member of our research community who was here on Friday has developed significant symptoms and has been given a prescription for testing by their physician. As soon as we know whether this is positive or negative, we will let you know. However, you should realize that this brings things to home, that once again, there is a person under investigation for the potential for having COVID-19 infection that may have touched surfaces or been in an area where you could be in contact. You may already have a virus, whether or not this individual is positive. So we need you to think about that. What is mission critical research? If you come in and you feel asymptomatic, Remember, you may be bringing something home. We don't want you to do that. For our students, we are now the last university that had held out really with a sense of pessimistic hope that somehow things would be lifted for commencement. We know at this time, like every other university in this state, that the current laws that have been enacted will not allow us to hold large gatherings that would have taken place on May 2nd. Our heartfelt sorrow for all of you in the fact that you'll miss this incredible standard tradition in recognizing what you've accomplished. That said, I've had meetings already with Mr. Rod Ingram and Ms. Sandra Emmerich, as we are moving forward, much as we did with Match Day, to ensure we create an opportunity for you to celebrate your commencement ceremony. And we'll do so in a way that makes it more personalized than you were used to. We are adding additional components to it to make it more meaningful in some ways, understanding we're having to give up some of the standard aspects that you're used to in a commencement ceremony. But I think that all of you will be pleased with what we've been able to accomplish. Currently, we have 3 potential plans in place, and Rod and Sandra will be reaching out to the student leaders to vet those ideas, and then reach out to the students as a whole to get your understanding of what will best meet your needs. We are committed to making sure that you have a celebration that is meaningful for the incredible hard work that you've been through for the last 4 years. It's an emotional time, lots of ups and downs. All of you now knowing where it is you're going into your future with Match Day, both between the College of Medicine and the College of Pharmacy. We will ensure a high quality and meaningful celebration, and we'll continue to update you on that. With that, I'd like to give you the opportunity as a community to ask questions. Much as last time, those questions will be brought into me by Michael, who will read them off, and I will answer them to the best of my abilities. Michael?
Something that has not been discussed much is employees that do not have duties that they can perform from home. Are they supposed to use their sick time, enter as such timesheet? What happens when that runs out? Are there any plans for the university to help out?
So I hope you heard the question. It's relative to our employees who normally wouldn't be allowed to work from home because of their job duties. We've tried very hard to share that message, and I know communication can be difficult. We have ensured that you are taken care of. What we've done is redefined what your duties are while you're at home during this period of time of crisis. In doing so, we're allowing you to do professional development and work development. Part of that includes Lean Six Sigma training, which is available online to you. Identifying deficiencies in your work areas and ways that we can really improve. This is really a time for us to innovate, think outside the box compared to what we would normally be able to do. We're ingrained in our day-to-day activities. So you will be taken care of. If you choose to go on leave, either use paid leave or unpaid leave, you may do so, and then you will have no job expectations during this period. However, if you elect to take pay, then we are required to ensure that you're performing this work, and we've established these programs for you to be able to do so. Our goal is to take care of you to ensure that our members are not being put under financial constraints during this difficult time of crisis. The one group that I should mention is our students who are part-time employees earning additional income to be able to support their lives. This is one group that we are not able to pay under our current circumstances. However, we do not want you to fall through the cracks. We had a discussion about this today. Our philanthropic organization, referred to as Advancement or our Development Office, has dollars available for 0 interest loans that will be available to you if you need these dollars to be able to support your daily living, food, beverages, health, and wellness. So please reach out to the President's office directly, in addition to your deans, and we will ensure that you have this available to you. If we need to in the future, we may be able to make these forgivable loans, but for now they are available at zero interest for your purposes. Next question.
Other universities in the Northeast Ohio area have announced that face-to-face instruction with students has been canceled all the way till the end of the semester, and they will continue with online instruction only. Is Neomed planning to do the same? And if so, when will the announcement be made to students, faculty, and staff?
So we have not set a deadline. We initially did, I believe that was April 3rd. We have now extended that, purposefully not giving a date, because we don't know what that end date is going to be. In all reality, it is almost certain that we will be extending face-to-face education be eliminated until the end of this semester. We know that that's almost certainly going to take place. The one caveat to that is for our third and fourth year students who have experiential requirements. Currently, the AAMC has asked that we not have students in the clinical setting until at least the end of this month. We've also been asked not to have them present by our healthcare providers, this being our health systems. That could change, as we may be asked to stand up and to do things that we have not been tasked to do in the past, whether that's getting involved in screening, whether that's getting involved in actually helping to take care of patients in the clinical setting in a way that we've been not asked to do so before. Again, we'll do so only if personal protective equipment is available to you and that you're trained with it, that we are mitigating the risks that would be associated with this level of training. But right now we are not there. And if we do so, certainly you would have the opportunity to opt out. We just don't know what impact that would have on your ability to graduate on time right now. But that should not be your priority. Your priority should be your family, your health, your wellness, and any dedication that you wish to pursue relative to your professions, which are now being thrust upon you very rapidly. Next.
What would your recommendations be for out-of-state students? Stay local or plan to go home for the rest of the semester if everything is online?
For out-of-state students, this is something that you need to determine on your own. Currently, most of our students as graduate students live in fully capable standalone apartments and houses. They have private bathrooms, private kitchens, laundry facilities, and these are essentially the same amenities that you would have at your homes. In making the decision to leave, while you are already appropriately quarantined or isolated within these environments, you are making a decision to potentially expose yourself during travel, something that we've been asked to eliminate. Discretionary travel we've been asked to eliminate it domestically, even on your off work time. If you expose yourself, you have to think about whether or not you could either now be an asymptomatic carrier or become exposed during travel, in which case, if you go home, you may be putting your families at risk. This is especially concerning if your families happen to be in the category of individuals who are at high risk. For instance, those over 60, those who are immunocompromised. You need to think about this and make a personal decision. For those of you who are in your third and fourth year, there's a chance that if we are asked to step up substantially by the government and by the AAMC and have to return to a clinical setting, that you would need to get back here immediately. So please weigh those as you make these decisions on your own.
Follow-up question. If students do plan to go home, would the school provide some sort of documentation in case they stop domestic travel because of a lockdown between the states?
I don't know that our school documentation will make a difference. If documentation is provided and we're on strict lockdown, the chances are you will not be allowed to return. I don't know whether the federal government is going to go that route. Governor DeWine was asked this on his last broadcast whether or not he was going to implement strict travel restrictions, and he noted he didn't think that was within his ability to make those types of executive orders, that those would fall to the President of the United States and the US Legislative Assembly. My guess is a note from the university would not carry substantial weight if there was a strict travel ban in place, and that strict travel ban would likely result in no flight availability.
Due to the backup in step 1 testing and potential for cancellation in the summer, does the university have a contingency plan regarding matriculation of M3 students?
Matriculation of M3 students will continue. We will find a way for you forward. I don't know whether we will be resolved by summer in that we will be in a position to be able to ensure that you get into your clinical settings. If not, we will work with the national bodies, including the LCME and the AAMC, to ensure that we have alternatives in place. We are doing that now for our 4th years, many of whom have required rotations in order to be able to graduate. We are waiving the clinical components of those and instead doing a virtual simulated opportunity for them to still get the knowledge that will be necessary for them to be good physicians here in about 12 weeks.
The Ohio State University has extended the tenure clock by 1 year for all tenure track faculty. How is NeoMed planning to address and accommodate the inevitable decrease in research productivity for tenured track faculty during this time of crisis?
This has been a topic that's been a high priority for the Inter-University Council President's Group. In fact, we received a text chain on this at about 9 p.m. last night, asking what each of the other universities were doing. Some, like Kent State, noted that their retention, promotion, and tenure process had already been completed for the year. They would reassess this as they move forward next year, and if necessary, provide additional extension. However, it was noted by most universities that the ability to provide extension is already in their university policies and would be able to be implemented without having to pursue any additional policy changes. NeoMed has already gone through the RPT process for this year. In fact, during our last board meeting, decisions were already made regarding advancement and the promotion with tenure on our faculty members from the preceding year.
Are there currently food service options available for students on campus?
The food service options on campus are now eliminated, is my understanding. As of today, we will finish delivering boxed meals to biomed high school students who are in need and at risk. And they are going to be supported while they were at home. However, we have shut down food services here on campus. I would suggest that everyone follow what has been already asked of us by the governor, which is social isolation and the 6-foot rule between individuals. Across the street, the Giant Eagle remains open. It remains well stocked for your purposes if you were here on campus. For those of you off campus, even with the stay-at-home order by the governor, he knows that you can continue to go to supermarkets, to pharmacies, and the ability to order takeout food, either for pickup or delivery, is still available to you. And we're asking that those are the options that you exercise.
Are students still required to come into NeoMed to take examinations?
NeoMed examinations is my understanding now, working with the deans, that we have implemented these as testing from home with monitoring on the computer systems. Each dean will send out separate emails to their students indicating how this is being performed.
Will Rootstown Community Pharmacy stay open?
My understanding is that Rootstown Community Pharmacy is going to continue to stay open to provide essential medications. Speaking with Dr. Kasmer, he indicated they had also ordered some of the malarial medications that are currently being utilized for the treatment of COVID-19, although it should be pretty clear that that data supporting their use is only anecdotal and it may not be efficacious. Along with that, we did put out some initial communications that if you were unable to measure your temperature at home, that you would be able to do so between business hours, Monday through Friday here on campus. That has now changed as they do not have the staffing or the PPE appropriate to be able to support that. Ladies and gentlemen, thank you for everything that you do for us, for keeping us fully functional and operational to meet the needs of our students, of our community, of our staff and our faculty. This is a difficult time. I understand communication is not always as clear as it could be. We are working to ensure that our communication is as succinct and as clear as possible. I will continue these updates on an as-needed basis to ensure that our community understands exactly what is going on here at Neomed and to share what is taking place more broadly in the state. Thank you for all that you do to us, for us. Please stay healthy and safe.